that this House has considered support for miners with pneumoconiosis. It's a great pleasure to serve under your chairmanship, Mr Bailey, and I thank the Minister for being here to respond to the debate and colleagues for their attendance. It's a privilege to have secured my first Westminster Hall debate on a subject of interest to many of my constituents and many informal coal mining communities across the UK. Mansfield, of course, has a proud coal mining history right up until very recently, with the closure of nearby Thoresby Colliery just a few years ago. The community was for decades built around the industry, and we still feel many of the effects of it. I applied for this debate because although coal miners' pneumoconiosis is not a terribly widely known illness, it's certainly prevalent within mining communities and is an illness which should receive greater attention. I've been contacted by a number of my constituents and unions about this issue, and I'm keen to raise it directly with ministers. I'm asking today for the Department of Work and Pensions to work with the Department for Health to review the diagnostic tools which are currently used to assess miners for signs of pneumoconiosis. Coal miners' pneumoconiosis is an occupational lung disease which is caused by the inhalation of dust from coal mines, often known as black lung. It causes thousands of deaths worldwide each year. Inhaled coal dust progressively builds up in the lungs over long periods of time, which leads to inflammation of the lungs, fibrosis, and can even lead to necrosis. The most common symptoms of pneumoconiosis are coughing and shortness of breath. The risk is generally higher when people have been exposed to mineral dust in high concentrations and if they've been exposed to coal dust for long periods of time. The coughing and shortness of breath can, of course, be symptoms of a wide range of illnesses, which is partly why it can often be overlooked by health professionals and others. Even when a former miner presents to their GP with these symptoms, it isn't always picked up straight away. Most miners would recognise that a cough is inherent from the territory, from working in those conditions, and many would not consider it as a symptom of anything more than their career underground. Many, therefore, don't come forward early enough, and this is where the problem lies. We need to do more to encourage this conversation. But many former miners who present with these symptoms are simply referred to their local hospital as an outpatient for a standard chest X-ray. Throughout their time working in the industry, they'll have had these X-rays regularly, but most will have been told they have a clean bill of health on the back of it. The trouble is that these traditional two-dimensional X-ray films often don't show enough detail to be able to diagnose pneumoconiosis, especially when the patient is in the early stages of the disease. The telltale sign of the disease is nodules in the lungs, which can be as small as 1 or 2 millimetres in diameter. When using X-rays for diagnosis, it's only usually possible to pick up on pneumoconiosis at a later stage, when large masses of dense fibrosis have developed in the lungs. By this stage, there's usually a notable decrease in lung function. It's too late, effectively. A successful diagnosis is also less likely because of the time that has passed since the PICS closed. The doctor they see now, the one who examines the X-ray, is less likely to have specialist knowledge of the industry and the related illnesses, and is less likely to have seen this disease before, so is perhaps less likely to spot it. But for the best results and the quickest analysis, a CT scan is the most effective diagnostic tool. CT scans show the lungs in 3 dimensions, which obviously provides a far greater detail and allows for more accurate diagnosis. I think for many of us it's surprising to learn that there isn't a regular screening programme in place for former coal miners to help pick up on cases of pneumoconiosis and other lung conditions. Many former miners receive their last X-ray at work. When miners retire or are made redundant, their access to regular X-rays simply stops. Former miners then tend not to receive another one until they present to their GP with symptoms like breathing difficulties or a persistent cough. Many fear they have cancer and are given the CT scan only to find that in fact it's pneumoconiosis. It's important to note that the latency period for pneumoconiosis is about 10 years, but it can be as long as 15 or 20. So the lack of regular screening once the miner leaves that environment, once they retire, is clearly a problem. I'm aware of several cases in my own constituency where miners have received the all-clear for pneumoconiosis after getting the old-fashioned X-rays at work, but the former miners have subsequently been diagnosed with pneumoconiosis after a CT scan has revealed the evidence of the disease.
Lee Rowley.
My friend is making an excellent point. I have personal experience of lung disease in the family, and both my grandparents were miners, and some of their lung issues didn't come to the fore until at least a decade after they'd left the pit. And I just want to emphasise how important it is for the words that he's saying in terms of ensuring that there is support throughout the process and throughout people's lives.
Ben Bradley for that intervention. He's absolutely right, and it's a prime example of why it's important that this assessment is ongoing, and why that people who used to work down the mines have that ongoing access to diagnosis and treatment throughout the rest of their lives. A few years ago, the Union of Democratic Mine Workers decided to run a test case. The UDM paid for 5 former miners who had recently been made redundant to have CT scans. And these men had all received recent occupational X-rays at the colliery, and each of them had received the all-clear from these scans. But when the 5 men went for CT scans, 2 were diagnosed with pneumoconiosis, and interestingly, 2 of the other 3 men were also diagnosed with other health issues that had previously been unseen from the X-rays following those CT scans. So 4 out of 5 had conditions that required this scan in order to get a diagnosis. So surely it's clear that former mine workers are at high risk of many different respiratory health problems, and that a CT scan is clearly the most effective tool for diagnosing it. But at the present time, the reality is that without post-retirement screening for pneumoconiosis, and with standard guidance from the DWP and the Department of Health promoting X-rays for testing, many cases of pneumoconiosis are simply not picked up until it's too late. It's a sad truth that it's often noted in a patient's file for the first time when they receive a diagnosis of lung cancer or other advanced respiratory illnesses, which is quite clearly unacceptable.
Gloria De Piero.
Of what he's saying in his speech. I just want to mention the compensation scheme. When people are deceased, if it is somebody other than the widow that it is claiming for compensation, it is incredibly onerous and expensive scheme. There are many, many hurdles to go through. Would the honourable gentleman agree with me that that process needs to be simplified and expensive hurdles scrapped?
Thank you for that.
And Bradley.
I agree it's important that people have access to that compensation that they rightly deserve, and that should be a simpler process as possible. Key to that, of course, is that the condition is diagnosed in the first place. In order to get access to that, they obviously have to prove that they have that condition, and it has to be diagnosed. So I was about to come on to myself. When it comes to pneumoconiosis testing, the issue's been battered about for too long between the Department for Work and Pensions and the Department for Health and regional CCGs, commissioning groups. Miners are rightly entitled to compensation and access to benefits as a result of work-related illness, including pneumoconiosis. And this compensation provides lump sum compensation payments to be paid to sufferers and their dependents. So the government has a duty to look after those that suffer from diseases caused by their working environment. Hard-working coal miners deserve their rightful compensation and disability benefits when their working environment has left them with an incurable illness. If individuals aren't diagnosed at an early stage, they not only miss out on vital health care, but also the welfare support that they deserve. In order to successfully claim the compensation, the miners must obviously prove that they have pneumoconiosis, and this is, again, where we run into issues. The DWP also relies on X-rays to provide evidence of pneumoconiosis for compensation claims. The compensation assessments are problematic. Former miners are frequently tested with digital X-rays, but even the newer technology struggles to pick up on the true condition of the lungs. Often the image simply isn't clear enough to be able to confidently diagnose pneumoconiosis. In these instances, if the claim is denied by the DWP, the miner will lodge an appeal. This takes considerable time and effort and will impact on the DWP staff and their time and resources too, as the application is processed for a second time. And in order to appeal the decision, they may undergo further diagnostic testing, including the all-important CT scan, which is an additional expense and carries an additional exposure to radiation. The argument against the use of CT scans usually focuses on 2 elements. One is the cost of those scans compared to X-rays, and the other is increased exposure to radiation. But in reality, when it comes to coal miners with suspected pneumoconiosis, if they don't receive a scan the first time, they're often simply exposed to repeated X-rays over a long period and then eventually a CT scan anyway, often when the condition has then already deteriorated, which is more time-consuming in the long run, ultimately costs more and can potentially involve increased exposure to harmful radiation. In this debate, I'm not asking for radical change to the testing programme for all lung-related compensation and disability claims, but instead simply an acknowledgement that the former coal miners are at high risk of lung conditions, that the diagnosis of pneumoconiosis, particularly in the early stages, inevitably requires a CT scan rather than an X-ray. There's a clear argument that DWP should consider CT scans as a definitive gold standard for the investigation of the investigation process in pneumoconiosis claims. There's a real possibility that there are thousands of former mine workers living with pneumoconiosis who have no idea that they have the disease. Their occupational X-rays showed nothing, and even if they raised health concerns with their GP years later, there's every possibility that, again, they would receive just an X-ray, which didn't show enough detail to diagnose the condition. The UDM is based in my constituency of Mansfield, and I recently met with Jeff Wood, the national president, and Ian Gill, who's the social insurance officer, and has been working on pneumoconiosis claims. They explained to me in great detail a number of the cases that they've personally seen where miners have suffered for years without an official diagnosis. It's often easy to sit in Parliament and look at issues on paper, but it's important to remember there are real people behind the studies and real families who would benefit from what is a relatively small and easy change of policy. It's important that any former miners who have been unnecessarily delayed in receiving diagnosis receive the rightful compensation and benefits that they're entitled to receive. So I asked the Minister if she can work with the Department for Health to bring about change and ensure that those that are entitled to the relevant support for pneumoconiosis are able to access it at the earliest opportunity. If the DWP can work with the Department of Health to replace standard X-rays with CT scans, there are a number of clear benefits. Earlier diagnosis for patients. This will allow them to make the necessary lifestyle changes to help improve their overall health. Of course, I will.
Gloria Dupre.
He is, of course, right to say that ministers, when producing new proposals or policy or guidelines, should consult with the trade unions, not just the Union of Democratic Mine Workers, but, of course, the National Union of Mine Workers too.
Of course, I think it's important that all of those involved are encouraged to come forward and talk to GPs, talk to government. I'm sure there's more we can do with that. I mentioned the UDM simply because it's them that brought this to my attention. We can achieve earlier access to compensation and benefit support from the Department of Work and Pensions. There are potential cost savings for the NHS, as an initial CT scan will help to avoid repeated X-rays, GP appointments, outpatients visits, as well as helping that patient be healthier and less reliant on those services generally. A reduction in the number of appeals to the DWP for these compensation claims, as the evidence will be provided in the first instance, and a potential reduction in disability claims in the future as sufferers are able to take action sooner to improve their lung function and their overall health before it deteriorates. The DWP now needs to take the lead on what is, of course, a work-related disease. In an ideal world, former mine workers would be offered additional testing at their GP and local health clinics, but what we really need to see now is national action. But once again, we're facing a postcode lottery in terms of what support is offered to miners. Some areas fare considerably better than others. Locally in Mansfield, we're lucky that the unions offer support to former miners, and there are also other areas of the country where these miners receive brilliant help and support. In Rotherham, for example, the Breathing Space Community Service helps people with a wide range of respiratory conditions and provides a number of health services, but importantly helps individuals and families access the welfare and benefits advice too. An example of unified working across departments with benefits advice available in a healthcare setting. As ever, the most successful programmes are usually those that offer the joined-up approach. It's that joined-up approach which I'm urging the DWP to support today. Ideally, the two departments will both agree that a CT scan is the most effective way of diagnosing pneumoconiosis. I'm asking that the department commits to reviewing whether their assessment for pneumoconiosis compensation can use CT scans as a default diagnostic tool, and I hope that DWP and pensions will work. DWP will work with the Department of Health to make this happen. It's a relatively simple change which shouldn't be too hard to implement, but which could make a real difference to thousands of former mine workers and their families. I understand that the UDM recently met with my right honourable friend, the member for Portsmouth North, when she was the Minister at the Department, and she expressed sympathy with their campaign. I hope the new Minister will also be inclined to give this issue the attention that it deserves. To conclude, Mr Chairman, the issue needs immediate attention. It's appalling that former miners are suffering unnecessarily and missing out on the compensation and access to benefits that they deserve. There's a postcode lottery and inconsistent access to CT scans. A nationally led system with Department for Work and Pensions and Department of Health cooperation could deliver more effective testing and better results. The change could help cut costs, reduce waiting times, and most importantly, provide the best support to individuals at the earliest possible opportunity. Because, as I touched upon earlier, this isn't an abstract discussion. It's a disease which affects large numbers of former miners, including in my Mansfield constituency, and affects them on a daily basis, and their families suffer too. It's a progressive disease, but if sufferers are diagnosed at an early stage, then they can receive care and support quickly and access the compensation and benefits that they deserve. And we mustn't let our former coal miners down.
The question is that this House has considered support for former miners with pneumoconiosis. Minister.
It's a pleasure to serve under your chairmanship this morning. First of all, I would like to congratulate the Honourable Member for Mansfield for bringing this really important matter to the attention of the House today. In his short time in this House, he has proven himself to be an extremely effective constituency MP. But I'd also like to acknowledge the contribution of his neighbour, the Honourable Member for Sherwood, and his continued focus on pneumoconiosis and the impact on former miners in his constituency. And I'm really pleased to see the Right Honourable Member for Derbyshire Dales and the Member for North East Derbyshire in the Chamber today, and thank all those who've made a contribution to this debate this morning. As the Honourable Member for Mansfield has said, pneumoconiosis is a very serious disease and is common, too common, among former miners. And it's a sad legacy of their exposure to dust, particularly coal dust, while working in the mines. Now, I really want to reassure him that the government is committed to supporting those former miners who have developed pneumoconiosis. We currently spend around 900 million a year supporting around 300,000 people with weekly benefits for injuries arising from industrial accidents or from specific occupationally caused diseases through the Industrial Injuries Scheme. And in addition, lump sum payments are available through the Pneumoconiosis Workers' Compensation Act 1979. And in 2016-17, over 3,000 people received payments under this scheme, totalling almost £42 million. And just last month, I was very pleased to be able to demonstrate our ongoing commitment to this support by presenting measures to increase the value of lump sum awards from April this year by 3%. And the coal industry pneumoconiosis compensation scheme, which is sometimes referred to as the coal workers pneumoconiosis scheme, is also available and has received 91,000 claims from mine workers and their families since it was set up. As the member for Ashfield did raise some issues about the processing of applications, I'd be very pleased to receive details of those concerns, because the devil is always in the detail, and by reviewing those constituency cases I can look to see what more we can do to improve the processes, because of course we want to make sure that people get the compensation which they richly deserve and are entitled to. I really do want to acknowledge the suffering of individuals with this disease. Coal workers' pneumoconiosis arising from the inhalation of coal dust is one of the most commonly occurring types of pneumoconiosis. Thankfully, many ex-miners with pneumoconiosis will have what is described the simple type, which may not be associated with any disabling effects. However, where they've continued working underground, inhaling coal dust, miners have a higher risk of developing severe disabling effects from what is called progressive massive fibrosis, which does affect lung function, causing cough, wheezing and shortness of breath. Now, this is why working miners are regularly screened by X-ray so that simple pneumoconiosis can be identified early and the person removed from further dust exposure to prevent progressive massive fibrosis. Now, the Honourable Member for Sherwood and members of the UDM met with my predecessor to discuss a screening programme for ex-miners using CT scanning or chest x-rays to detect pneumoconiosis. Now, following that meeting at the end of last year, I consulted with national experts and the Deputy Chief Medical Officer on all the issues which were raised at that meeting. I think it's important to say that there's a big difference between carrying out medical tests on a person with symptoms and a healthy person. The symptomatic person needs to know what is wrong with them to get an accurate diagnosis so they can receive the treatment that's right for them. But the healthy person undergoing screening tests believes they are healthy and will continue to do so, facing no risks from health interventions. Now, because screening programme risks harming people's health, we really demand a high level of evidence to make sure that any screening, when put in place, does no harm and genuinely has a benefit for people overall. So, having looked at all the evidence that was put forward, the view was very clearly expressed by the medical experts that introducing a screening process in the UK does not meet those thresholds for evidence and actually would not be beneficial. Because when pneumoconiosis is identified, often no treatment is required. And when it is severe, there's no specific treatment available. There is no health benefit to identifying it at an early stage once a miner has left mining. The advice I've been given is that the potential harms vastly outweigh any gains from screening for pneumoconiosis by X-ray or CT scans. However, I'm very mindful of the discussion this morning and the information that's been shared, and I think it's really important that we have a following meeting with the members from Mansfield and Sherwood and other members that are very welcome to come along, and I'll set that up with the Department for Health and the National Health Service so we can really explore this further, because I'm sure members will want to know we're leaving no stone unturned to do the best we possibly can for the former miners. Now, the Industrial Injuries Advisory Council is an independent scientific advisory body that looks at industrial injuries benefit and how it's administered, providing advice to the department. Now, I am aware that the issue of the use of CT scans for diagnosis of pneumoconiosis has been discussed by the Council in the past, including the risks of increased radiation exposure. And again, following this debate today and the issues that have been raised, I will approach the Council anew and I'll ask them to consider again the use of CT scans and ask them to give me further advice. And of course, this is something that I'm happy to share with members. Now, the member for Mansfield quite rightly raised the issue of raising awareness amongst former miners. Too often, they don't come forward. They assume that having coughs and colds is just part of being a miner or being a former miner. And I do think there is much more we can do to really raise awareness amongst the former miners and their families and communities to come forward and to speak to a GP, because much work has been done in the last couple of years on improving the care pathways. A lot more information and training has been given to GPs. So if they do come forward now, they will experience, a much better quality of care and rapid assessment to make sure and check, either through an X-ray or a CT scan, whether they do indeed have pneumoconiosis. So I think that again is something we can take away from today and work really urgently on that matter. So once again, to summarise, I'm very grateful for honourable members who've come along today, and particularly to the member for Mansfield for bringing up this issue today. I can absolutely assure members that this government will continue to support former miners with pneumoconiosis, not just financially in all the schemes I've described, but really looking at the diagnosis and their health needs. They've contracted this disease while making a vital contribution. Yeah.
Dan Jarvis.
Giving way. I think very helpfully and constructively, she said just a moment ago that she was planning to have a subsequent meeting with members. And I just wonder whether she'd consider the National Union of Mine Workers, who are based in my Barnsley Central constituency, whether she'd be content for them to come along, because I think they would have a constructive contribution to make to this process.
I thank the honourable gentleman for his intervention. Of course, I'm happy to work with anyone who is going to make a constructive contribution to see that we make sure that former miners are aware of the risks that they have to their health, and they seek help at the earliest possible stage, and that we support them to get a diagnosis, and if they are diagnosed, to get the treatment that can support them, but also the compensation that we absolutely are proudly giving to people who suffer in this way. We must remember that miners contracted this disease while making a vital contribution to the growth and prosperity of this country, and it's only right that they should receive our support at the time when they need it most. Thank you.
The question is that this House has considered support for former miners